Let's start with all of the bones of the pelvis put together. This structure here can also be called the pelvic girdle, indicating that it's a place where the limbs attach. Humans also have a pectoral girdle, which is the scapula, clavicle, and the humerus, or part of it, and maybe even a little bit of the sternum. The pelvic girdle includes the sacrum, which is this bone right here. It includes the coccyx, which you can see a little piece of down here, but the coccyx and the sacrum in this picture are hidden behind the two coxal bones, which are more commonly called the hip bones. And so we have the left and the right coxal bone. Of course, this structure makes a very large hole in the center, which is where all of your squishy organs are. The coxal bones can be quite difficult to get to know. When they're attached to the sacrum and coccyx, it's really easy to understand their alignment. However, when students receive the coxal bones, whether in person or on a picture, if they receive the coxal bones disarticulated, like these two pictures here on the left, it becomes increasingly more confusing to try to orient the bone and find the anterior and posterior sides. Remember that this difficulty is shared among students who take the class in person and students who take the class online. Therefore, it is always, no matter what modality, very easy to confuse the left with the right or the anterior with the posterior. Let's do the easy stuff first. This big hole in the hip bone is called the obturator foramen. The big depression in the hip bone is what you might want to call the hip socket, but that, of course, it has a more complicated name, acetabulum. This word means vinegar cup. And the acetabulum is actually the place in the bone where the three fused bones come together, the ilium, the ischium, and the pubis or pubic bone. These three bones come together at the acetabulum, giving it its incredible strength to bear the weight of your body. There are three structures that can help us get to realize which or where each of these three bones are in terms of the coxal bone. Put your hands on your hips. And what you are feeling is the iliac crest. And this is the top part of the ilium bone, which is the big curved area up here. You have lots of difficult to stretch muscles, like the pisiform, that run over this area. Touch the bony projection at the front of your pelvic cavity. This is the pubic crest, which is on the pubis or the pubic bone. This is, I'm going to make this red in this picture here. Just this little bit right here is the pubic crest. It's really not a big bone, the pubis. As you can see, the ilium is the bulk of the hip bone. So we have two crests that help us remember that the ilium is along the top and the pubis is anterior or at the front. Have you ever had to sit on the floor or a hard chair and you feel like your butt bone hurts? That would be your ischium. And what is bothering you in the ischium is this ischial spine. Is basically that is what you're probably sitting on, and that is what creates the pain. Okay, so when you're presented with a hip bone, it's easy to find the acetabulum or the hip socket and the obturator foramen. You should always locate those two things first, even if you're not asked to identify them. Other than that, it is very easy to get mixed up and not be able to tell anterior from posterior. There is a trick to this. Do you know someone with back pain? Oh, yes, you do. Me. Sorry. And whenever they have back pain, they will refer to this big nerve that runs down the back of the leg. And they might say something like, oh, my sciatica is acting up. Yes. The sciatic nerve runs down the posterior and a little bit of the anterior of your leg, and there are notches in the hip bone that allow its passage. The greater sciatic notch and the lesser sciatic notch are both on the posterior sides of the bone. These notches, especially the greater sciatic notch, is a larger indentation than anything else on the coxal bone. And this indentation allows that big, huge sciatic nerve to run through it. Notice how there isn't an indentation as deep as this on the anterior side. So once we find the greater sciatic notch, we can locate the lesser sciatic notch below it. In this view, we can see the bumpiness of the ischial tuberosity. The bumpiness is from the attachment points of ligaments and muscles in your legs. And this is the butt bone, which also the ischial tuberosity can tend to hurt, just as the ischial spine does if you are made to sit on a hard surface for a long time. We know that the big rounded top here is the iliac crest. And the area below this, which is actually a curved area, kind of forming a bowl, is called the iliac fossa. There are 4 other structures on the ilium which tend to be very troublesome, especially if you don't orient yourself as to which side is anterior and which side is posterior using that huge indentation of the greater sciatic notch. Okay, so look at what we have labeled here as spines. To me, these are like slight bumps, very slight, on the outer border of the bone. These are attachment points, right? Ligaments and large muscles of the hips attach at these spines. In fact, misalignment of these attachment points can lead to sciatic problems. Let me just point out to you here that there are 4 spines. 2 at the back, so 2 of them are posterior, 2 at the front, 2 of them are anterior. Or you could say that there are 2 at the top, so 2 of them are superior, and 2 at the bottom. 2 of them are inferior. Each of these spines is named based on whether it is front or back or up and down. I'm good at finding the posterior inferior iliac spine, which is sometimes abbreviated as PIIS. I'm good at locating that because it is right above the sciatic notch, and that notch is easy for me to find. I feel like the posterior spines are like these 2 nubby fingers that come off the back of the hip bone. The anterior spines, I don't find them as easy to locate, but the simplicity in the naming is the same. Both of these anterior spines are on the front of the bone. One is superior and one is inferior. I guess I sometimes use the iliac crest to locate the anterior superior iliac spine. It is the very curved ending of the iliac crest at the edge of the bone. So there is a term called the ala. The ala, which is a word that means wing, includes the iliac crest and the 2 spines. So the ala is a much larger structure than the iliac crest itself. So don't be confused about this term ala, which incorporates posterior superior iliac spine, iliac crest, and anterior superior iliac spine.